Access to water has been a recurring challenge to people across the globe, and reports have shown that water scarcity affects more than 40% of the global population and is projected to rise. Those who are more affected are women and girls, who are usually responsible for collection of water in 80% of households without access to water on premises. The United Nations Children's Fund, UNICEF, reported that poor access to improved water and sanitation in Nigeria remains a major contributing factor to high morbidity and mortality rates among children under 5. The use of contaminated drinking water and poor sanitary conditions result in increased vulnerability to waterborne diseases, including diarrhea, which leads to death of more than 70,000 children under 5 annually. However, as of 2015, only 69% of Nigerians have access to improved water supply, with 57% of them being of rural population. While numerous rural communities across the country have been faced with water challenges, residents of Idoka community of Obokun local government area of Osun State also share their experiences and difficulties they encounter to access drinking water, as they have to travel a long distance and climb hills before they could fetch drinking water from the only source within the community, popularly called Omioko, the only source of drinking water in Idoka community, which serves 3 other neighboring communities, Iregun, Idominonsi, and Ilowa, especially during dry season, is located at about 2 kilometers from the center of Idoka community and situated in a valley where users have to climb hills before they could connect the community after fetching the water. Some of the women who, due to old age and ill health, cannot climb the hill, have to allow the younger women and children fetch drinking water for them, or engage the services of those who would fetch the water for a fee. Though they prefer to drink from Omioko instead of any other water source within the community, the challenges they face in accessing the water they believe is affecting their source of income, as they devoted same time to their farm work or businesses. Speaking, Chief Mrs. Deborah Adebisi, the Yererisa of Idoka community, explained that fetching water from Omioko is a difficult task for all, and unfortunately that is the only source of drinking water within the community, except for sachet water. On her part, Chief Mrs. Adejoke Obileye, Yeyewogun of Idoka community, lamented about the challenges pregnant women and nursing mothers encounter as they find it difficult to climb the hill after fetching water. She explained that the elderly women who couldn't climb had to send their children to fetch, or rather pay for people to fetch for them.
Bàbá ìtọ́tọ̀ bàjẹ́ ó parí.
Ìṣòro tó wà pẹ̀lú omi, pàápàá omi mímu nílẹ̀ náà ni pé omi mímu lẹ́yìn omi oko, omi ilẹ̀ tá a mu nìkan. Àwọn kànga tó ń gbẹ́ ń bí ó ń rọ́, kò ṣeé mu. Omi yẹn dẹ̀ ní bó ṣe dùn ún mu tó, ó difficult fún àwọn èèyàn láti lọ máa pọ́n toró ní òkè. Torókè wà ńbẹ̀. So ìgbà tá a wà kékeré tá a bá fẹ́ lọ sí omi yẹn, a máa ń kọ orin kan pé omi oko dùn ún mu àti gòkè ló ṣòro. Ìgbà tí ó tó ṣe díẹ̀ tó rí pé òkè yẹn torí amọ̀ ní ibi bẹ̀, ó máa ń difficult fún wa. Tójò bá ti lè rọ̀ báyìí lásìkò òjò yẹn, ó máa ń yọ̀. Wọ́n ṣe step síbẹ̀, pọ̀pọ̀ kan ṣe step síbẹ̀ náà. Still náà ó sì difficult díẹ̀ fún àwọn tó bá ti dàgbà díẹ̀ láti pọn. Àwọn ọmọ kéékèèké ló sábà máa ń lọ síbẹ̀ lọ pọ́n torí òkè yẹn, but òun la mú láti jọ aláyé ti dáyé, omi oko yẹn la máa mú.
Wàhálà omi mímu ní ọ̀dọ̀ rẹ̀ ó nira láti pọn omi torí omi odò ni à ń pọn, àti gòkè gan láti pọn omi yẹn ó máa ń nira láti pọn fún wa torí omi alẹ̀ ni. Àwọn olóyún tán bá wá tán bá fẹ́ máa pọn mi, ó máa ń nira fún wọn láti gòkè láti pọn omi.
Checking the health implication of the stream water on the people's health, a nurse in Idoka Primary Health Care Center, who is also an indigene, confirmed there has never been an outbreak of waterborne disease in the community, adding that the water is more preferred and treasured by villagers. A core member serving in the community, Omeke Ikechukwu, said himself and other core members in the community buy sachet water to drink, as they could neither go to the stream nor drink from the well, which is close to their residence. Omeke believed he would have been able to save more from his monthly allowance if he didn't have to buy sachet water for drinking purposes.
It's not friendly at all, because most times you might be short of cash to buy the sachet water and you spend more on it. Each time we buy, at least in a week, we buy nothing less than 6 bags of pure water for drinking. I know it's very much expensive.
Previous interventions to make water accessible for all within the community were described as either insufficient, inappropriate, or inaccessible. The community in 2003, after the Idoka Day celebration, used the funds generated to build boreholes in 3 strategic locations within the community, but they are no longer functional. The African Development Bank, Federal Government of Nigeria, and Osun State Government hand pump water project in 2018, which is situated close to the palace, is a bit far from people at the other side of the community, and residents consider it a bit difficult to pump the water. The women in the community who are saddled with the responsibilities of providing water for their families believe that adequate and sufficient intervention should be provided to make drinking water available and accessible to all.
Afẹ́ kó ìjọba ṣomi kó ṣe fún wa ká rómi máa pọn ká dé rí ohun lò.
Tí ìjọba bá lè bá a ṣe tó mú omi oko wọnú ìlú kán bá a ṣe.
Nǹkan tí ìjọba lè bá wa ṣe, tó bá lè bá wa wá bí omi yẹn bó ṣe máa wọ àárín ìlú. Nǹkan tèmi rò pọ́n lè bá wa ṣe nìyẹn. Bóyá páìpù náà máa gbé lọ síbẹ̀ ò tá ń bá wa fà wá sí àárín ìlú. Torí àwọn kànga tó ń gbẹ́ kò sí lè tó dàbí omi yẹn níbi bẹ̀. So tí ìjọba bá lè ràn wá lọ́wọ́, tómi yẹn bá lè wá sí àárín ìlú ká máa pọ́n. Àbá dúpẹ́ lọ́wọ́ ìjọba.
It is evident that residents of Idoka community in Obokun local government area of Osun State encounter some sort of difficulties in accessing safe, clean, and portable water. To ensure the attainment of Sustainable Development Goal 6, which seeks to achieve safe and affordable drinking water for all by 2030, there is need to consider and engage all rural communities in all intervention programs to be provided by government at all levels. Blessing Oladunjoye.
Omi oko dùn ún mu àti gòkè ló ṣòro. Omi oko dùn ún mu àti gòkè ló ṣòro.